there's a viral news story I think you might want to know about. A Pfizer executive recently admitted that they did not even know that their mRNA COVID-19 vaccination did not block transmission of the pathogen. Now, this is really important. I'm going to play that clip. I'm sure you've seen it by now. It's been viewed millions of times over on Twitter. Thankfully, Twitter hasn't even censored this up to now. Hopefully, YouTube won't as well. But this is really important because many people were promised by Dr. Anthony Fauci, Rochelle Walensky over at the CDC. Even the president of Pfizer was on numerous news outlets saying the reason why everyone should go out and get the immunization is because it blocks transmission. Yet company executives just admitted that they didn't even have the data to show that. Now, you might say, Mike, this is old news. Hindsight is 2020. Why are you talking about this now? People have been fired from their jobs. Elective procedures at many major medical centers, this includes cancer screening, heart disease screenings, birthing centers and so forth, had labor and staff shortages because people were fired or terminated for not getting the vaccine, even if they had proof of prior infection. So let's play this clip very soon and talk about this news story and talk about the implications here in the big picture, why I care about this. And first and foremost, friends, let's leave the comments productive. Okay, you can share your thoughts, share your perspectives. We can learn a lot from each other in the comments. And so I just want to make sure that this is a productive discussion. But here's the story. Pfizer did not know whether COVID vaccine stopped transmission before rollout, executive admits. This was published over at news.com.au. So essentially, Rob Roos from Netherlands, he is a member of the European Parliament. To the best of my knowledge, he's not extreme left or right. He is just simply seeking to find the truth, much like you. We want to have transparency and belief in science and major companies that are foisting their products onto individuals. And when a government is creating policy that mandates that you get certain things based upon the fact that it's supposed to do something, you want to be able to trust that information. Okay, so a senior Pfizer executive has admitted that the drug company did not know whether its COVID-19 vaccine prevented transmission of the virus when it began rolling out the shots globally. So Janine Small, I'll play this clip very soon, he asked a question because for some reason the Pfizer's president of international development was not able to be there. So it was another individual. Her name is Janine Small. She was asked a straightforward question, and here was her response.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunization before it's entered?
So she doesn't directly answer the question, did we know about stopping the immunization? The question was, does the immunization block transmission? So I think it's important to understand that she doesn't even directly repeat the question properly or answer the question, but let's hear her what she has to say.
To the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
Everything at risk. So why then did many of the public health authorities all throughout the world, this was here in the US, regionally, state governors, mayors, local policymakers would mandate restaurants require their patrons to be vaccinated. If you wanted to travel internationally, to go to Canada. I mean, in fact, Canada just in the last 10 days backed off their policies in terms of requiring non-Canadian citizens be fully vaccinated prior to visiting the country, right? You have all these people, colleges, right? Remember, many colleges, we're talking about Stanford University, we're talking about Boston College, we're not talking about small little podunk colleges, major institutions that ostensibly follow science and research made students, albeit low-risk students. These are children essentially between the ages of 18 and 22 years old that are attending college, statistically at incredibly low odds for developing severe complications or dying from COVID-19. These individuals were not only required in many instances to get 2 shots, but 3 shots last winter. Okay. So you're like, but why? Because the promise that was made to us was that if you get these vaccines, you will block transmission. You will protect your grandma. What turns out, again, Pfizer admitted They did not have that data, that information. So my question is, where did this come from? Who made this narrative up? Was this hopeful, wishful thinking? Is that what it was? Because what Pfizer had shown in their studies, and Moderna and the other manufacturers, is, well, statistically, these people, a certain subset of the people who get the immunizations, have a lower odds of contracting severe complications and dying from COVID-19. That is a completely different outcome versus blocking transmission, okay? Now we can talk about athletes. Okay, this is another important thing. People say, Mike, why do you care? If we look at Novak Djokovic, he is still facing challenges playing tennis internationally, competing in high-level tennis tournaments and competitions. If we think about Kyrie Irving or Aaron Rodgers, who is completely smeared in the media, those two individuals, for choosing to not get a mRNA vaccine or any of the COVID vaccines. Why? Because they're like, hey, I'm a pro athlete. Like, this is what I do for a living. I take care of my body. I'm not worried about dying from a virus that millions of people, hundreds of millions of people in the US have survived already. So the media portray these people as anti-science, as wanting to harm other people, as not, stepping in line with doing what is right. Well, look, if this vaccine was never shown, again, Pfizer's executive just admitted it, YouTube, so you can't, maybe you can censor me, okay, it's your platform, but how can we say that we're following the science if there was actually no science to say or to indicate or to suggest that these vaccines block transmission? Now, again, the real reason why I care is I have a daughter. I have friends and family members. I have friends who have suffered consequences as a result of getting this vaccine that were healthy at statistically low odds of getting severe complications, who have lingering health issues as a result of these immunizations. I have friends who are having relationship challenges. In my own family, there's tension and relationship challenges due to different perceptions and beliefs about what these immunizations can or cannot do. Now, that's a problem, my friends. So this is not just like, oh, hindsight is 2020, it's no big deal. These issues still persist. And I have friends that are healthcare workers that understand the science, that are co-parenting, meaning, the ex-husband is in another home, who are foisting the vaccines on the children, and the parent is just at a loss with this, and there's legal issues. Like this, my friends, has created so much unnecessary problems within our communities, within our most important relationships. And that is problematic. Even more problematic is the cancellation of elective procedures. These are diagnostic imaging procedures for people that have cancer, for people that had to get orthopedic issues. Imagine last winter, let's say you broke your ankle in a car accident and you just wanted to get it repaired, for example, and the hospital was canceling elective procedures because they didn't have enough staff, because the staff that opted to not get these vaccines were fired, okay? What about those people? If we care about lives lost, many people who maybe had symptoms of, say, cancer, maybe they had bloody stools or things like that, but wanted to go to the hospital in December, January, February of 2021, December, and then January and February of 2022, there was all widespread cancellation of procedures, closures of medical clinics, and so forth, because of staffing shortages that were created around this issue that the vaccines completely block transmission, and anyone who doesn't get the vaccine is therefore going to be at risk of getting others infected, when in fact that basic premise was never established fully in the science. So that's why I care about this. In Washington State, this is a crazy story I've shared with you before. We had a really big snowstorm during the first week of January in 2022. Now, there was not enough snowplowers because they were terminated for not getting the vaccine. Okay, so imagine the Department of Transportation terminated snowplowers. Okay, these are people that are driving in trucks by themselves plowing snow. Why are you going to force them to get a vaccine? They're not like bouncers at a concert of 50,000 people. They're snowplowers. So in King County, they had a shortage of snowplowers because they were terminated for not getting a vaccine. So the major thoroughfare here to deliver food, medical supplies, all sorts of things was closed for about a week because the governor and the Department of Transportation here in King County would not allow unvaccinated snowplowers from an adjacent county to plow the snow, to clear the roadway. So you had food shortages, you had test shortages, you had medical supply, you had all this stuff. Completely unnecessary. And you might say, well, Mike, that was because of No, that was because of people digging their heels in the ground about an idea hopeful, wishful thinking that turned out to be not, number one, based in science, and number two, turned out to be now not true. But we had the evidence at that point that this was not true, because in King County, in the Seattle area, in New York, in LA, when did we see record numbers of cases and people getting infected? December and January of 2022, after people had already gotten these vaccines, not one, not two, but three. So again, the evidence was clear back then that these immunizations, although they can potentially reduce the risk of death or severe disease in some people, they do not block transmission. But that didn't cause policymakers to change their minds, okay? And that's why I'm frustrated by this. I, like you, want truth, want transparency. We should be able to trust what the CDC says. We should be able to trust what our governor, our mayor, our president says when they say, this is what X does and this is why you should or shouldn't get this thing, whatever it may be. We should be able to trust that. Now, we're at a level where trust in major institutions, and sadly, major medical institutions, is at an all-time low. And because I have a child, I worry about this. I worry about our future. And now we're going to have to question everything. So I wanted to share this clip with you, and hats off to Rob Roos for asking tough questions. And, you know, really, it seems like folks in the UK, in Europe and Australia are actually starting to ask the tough questions that for some reason doctors and policymakers and politicians are scared to ask here in the US. And so, like you, friends, I just want transparency. I want honesty. I want all of our family relationships to be repaired at this point. And so we need to promote the truth. And it seems like the truth is finally coming out. So thank you for individuals like Rob Roos over from the European Parliament here for asking the tough questions. So what do you think about that? Let me know in the comments. Thanks for hitting that like button. Thank you for subscribing. You can support our channel, support our work by purchasing some t-shirts like this one. The germ is nothing. The terrain is everything. And it's important that we are honest and transparent when it comes to science. So appreciate you tuning in. We'll catch you on a future video down the road.